Early Ambulation After Surgery by Carmen,
Paige,
and Tegan.
Tegan is undergoing a left knee replacement.
What intervention will Nurse Carmen and Nurse Paige implement to enhance Tegan's recovery after surgery?
Good morning, Tegan. How are you feeling today?
I'm doing good, just a little sore.
Would you like to go for a little walk this morning?
No!
Well, early ambulation is really important after a surgery.
Oh, why is that?
Early ambulation has many benefits, including prevention of clot formation, faster wound healing, increased strength and coordination, as well as balance, muscle tone, and joint flexibility. It also reduces length of stay and risk of infection, prevents pressure ulcers, and complications of the respiratory, circulatory, gastrointestinal, and urinary system. Let's talk about some of these in detail. Early ambulation significantly reduces the risk of clot development. Muscle activation plays a key role in the transport of blood back to the heart. If the patient is immobile for long periods of time, which commonly happens after surgery, blood can pool in the veins and form a clot, leading to life-threatening complications such as deep vein thrombosis and pulmonary embolism. Ambulation stimulates contraction and relaxation of muscles in the lower extremities, preventing venous stasis and therefore limiting the chance of a clot forming.
Ambulation leads to faster wound healing because it stimulates circulation. This means that more blood, and more importantly, oxygen, can reach the area of the body in need of repair. Oxygen enhances the function and efficiency of every cell in the body and plays a critical role in the formation of collagen and growth of new capillaries. Reducing the time it takes for a wound to heal leaves the body less susceptible to infection.
Immobility after surgery can cause mucus and other secretions to build up and settle in the lungs. This can restrict lung pathways and cause superimposed bacterial proliferation, resulting in complications such as pneumonia and atelectasis if not corrected. Ambulation increases pulmonary ventilation and promotes deep breathing, reducing secretion buildup.
Surgery can halt peristalsis and delay gastric emptying, which can lead to complications such as constipation and paralytic ileus. Patients can also experience incontinence and urinary retention after surgery. Urinary retention can cause abdominal discomfort and more severe complications, including urinary tract infections. Ambulation stimulates sympathetic nerves to the intestinal and abdominal muscles, increasing peristaltic activity and the urge to void. It can also help decrease gas pain and helps the patient regain control of their bladder and bowels, reducing instances of incontinence.
All of these factors contribute to reduced length of stay. One study found that patients who went for surgery and missed a day of ambulation added 3.1 days to their hospital stay. Participants were found to have left the hospital 2 days sooner if they increased their ambulation by at least 600 steps between the first and second day. It is important to recognize that there are barriers and enablers in practice settings that can affect early ambulation after surgery. The type of surgery that the patient has undergone, as well as personal experience, can drastically change the patient's care preference. For example, a patient that has undergone back surgery and is having 10 out of 10 pain would likely be less willing to ambulate than a post-operative knee surgery patient with 4 out of 10 pain. Because of this, healthcare professionals need to enable their clients and set them up for success. This includes setting the expectation of early ambulation after surgery so the patient can anticipate and prepare. Encourage and positively reinforce the patient when ambulating. Educate the patient on the effects of early ambulation and offer analgesics before activities if required.
Early ambulation after surgery is current best practice, but because there are barriers to application, the nurse should consider alternatives such as ankle pumps and other bed exercises or deep breathing and coughing. Because of the high turnover rates and busyness that med-surg floors experience, the nurse should collaborate with other healthcare professionals such as physical therapists to make sure their clients ambulate. To improve health outcomes, they can also direct their patients to the AHS website to look at the Enhanced Recovery After Surgery protocol. It uses current best research and practice evidence from around the world to standardize care for patients before, during, and after surgery and reduces length of stay and post-surgical complications.
So, do you feel like going for a walk now?
Yeah!
Tegan is now being discharged home sooner than expected, largely due to early ambulation.
Yay!